Hi, welcome back to Spinal Attraction. Shout out to my subscribers. Thank you very much. You're helping me make this grow, and I love continuing to learn and using ancient wisdom with modern diagnosis and techniques to continue to learn and grow and pass it on. Thank you very much. Okay, so I do not diagnose or prescribe. But today I want to talk about some wrist problems that I have encountered, and massage therapists may really want to check this out. Other people, possibly tennis players, anybody really, well, people, we use our wrists, and we have 8 little bones in here that are held together with ligaments. Ligaments hold bone to bone, remember. And this is a very flexible joint, obviously, for most of us. And it's somewhat vulnerable because of that. Vulnerable. So, probably 6 or 8 months ago, suddenly I had quite the pain right here on the pinky side of my hand. Radius and ulna are these 2 bones. And the way I remember it is radial type motion is the radius. The ulna is over here. So the ulnar side is what I'm talking about. This little bone right here. Not the end of the ulna, but just inside that, just towards the pinky finger. From that, this little bone, I've actually had it just pop right out of place sometimes. Not even doing anything, and it can really hurt. Well, I've learned how to press it and even pop it back in place, and I can hold it, and it really helps. But what I did was I tried out some different braces and things, and I found this little brace on Amazon, and I will have a link to it in here. It's only 10 bucks, and I will show you in detail how to put this on. I'm just going to mention right now, there's this space here. If you are going to use this while you're working on somebody, where the Velcro comes together, you want that on top of your wrist, or this will be rubbing on your client's body. So I'll go into more detail further in this video. I also want to show you the book that I wrote, the Back Bible, currently on Amazon. Discover the truth before deciding your own fate. Yes. So there's a lot of things in here that I did not know about when I had my first back surgery, which led to second one, third one, and fourth one. If I'd have known that, things would be different. Let's see. So there's something called TFCC. That is not what we're talking about. And it's also, as far as the wrist, it's also not carpal tunnel. I understand if you can do this for a minute or more without any issues in your fingers or wrists, you do not, that is an indication that would be carpal tunnel, and that would be the thumb and these 3 fingers. What I'm talking about is the opposite side, basically in the wrist. As I said, I would give you kind of a basic instruction here. It's not a big deal, but to put this brace on with one hand is a little bit difficult to figure out the first time. Like I said, I would have a link to these. You can find a link to this, and there will be these rubber bands, and there's a reason for that, and a link to my book. So let me show you. Come around here. You can put this on this way or this way, but what I want to show you, the easy way, is to just get that, however close you can get it, doesn't matter at first. Then I'm going to tighten this up so that this is lined up pretty good there, and pretty much at the end of that or so. Then I can go back, press here a little bit, and wind that a bit tighter if you want to. That's how I like it. Nice and snug. That is keeping this right up against that bone that has been an issue for me if you're having a problem with your wrist. However, you know, what's bothering you, you figure that out. But this gives a nice snug, it's like a hug. It's firm, but not cutting off circulation. You can leave it on for a decent amount of time. And again, if you are doing massage therapy, this does not get in your way. If this side is around here, it will irritate a person like that. So now the old ones, probably 6 months I've had these, the elastic gets a bit worn out. And until I just got my new ones, I would do the same thing, pretend like I put this on here, and then those big rubber bands I showed you, I get it around like this and put it in the same area, and it's more pressure again. Sometimes I've used 2 rubber bands, and it takes up where the elastic is worn out, and I could still use them for a pretty good amount of time. So there you have it, and I hope this helps you out. And again, like I was talking about, subscribing really helps to grow the channel, and I want to reach as many people as possible through the internet. Thank you, and stay curious.